especially women during pregnancy and postpartum. And there's a lot of common misconceptions out there regarding that it should hurt. So people expect it to hurt, they accept that it hurts, they don't seek help when they hurt. Please note, I'm not talking about delivery. Ray and I had an interesting discussion about delivery could feel better with certain interventions, but I do think disclaimers are important. I do work in co-own Entropy. We host a ton of continuing education courses that are amazing. Again, huge bias on my part. But then also, I am really biased in my practice to thinking that women and men are strong and resilient beings. So I do believe people can get better. I do believe people can do a lot to help themselves. All right, so pregnancy. So I've never been pregnant. I've not gone through that. It's amazing that women can do this. They can produce a person over the course of 40 weeks. So these are some common things that happen during pregnancy. So you gain weight in a lot of different places. And we know that adding weight can make you feel differently, but there's just a lot of things going on, up to 24 pounds on average, but up to 75 extra pounds. It's like an extra leg. Okay, during the first trimester, women will experience some morning sickness, some soreness in their breasts, frequency of urination, not because of the fetus pressing on their bladder, it's just totally hormonal. And then constipation, also totally hormonal and not much fun either. And then moodiness. Second trimester, some people tend to feel a little bit better, but they continue to have some issues that are different than when they're not pregnant. And then the third trimester, this is when you have like an actual baby on the inside that could make it on the outside of the world. And all of this stuff makes sense. The breathlessness, it's hard to breathe. Baby's pushing the diaphragm up and you can't really expand your lungs. You get swelling, possibly preeclampsia. Luckily, that's not the case for everyone. So there's a lot of things that happen. And this is one of my favorite pictures because if you look at the picture on the left, stuff inside of us it's packed in there pretty well. There's not tons of extra space floating around. And then we put in a child, and everything smushes out of the way. It's amazing to me how the bladder gets smushed down so far, and everything else gets pushed up so far. It makes sense that how you move is going to change, how you hold yourself is going to change. It has to change. That being said, this is not easy. Like, to be able to do this, I feel like it takes a lot of work. And then the baby has to get out. And I just have a vaginal delivery here, but regardless of how that baby comes out, it's a commitment. And there's really not an easy way. So sometimes people will be like, well, isn't a C-section a little bit easier? Honestly, no. Recovery is about the same. All right, so can I see a show of hands? How many people here think that having pain and hurting during pregnancy is normal? Okay, so yeah, so there's some discomfort, and I'd say it's about as normal as having pain at any point in your life. Yeah, so pain is a normal part of life. It's to be expected. But during pregnancy, it's almost like people are like, well, you're pregnant, what do you expect? Where if like you come up and you say your back hurts, people are like, well, let's see what we can do about that. So yeah, nope, not really. But really, most women will experience some kind of low back pain or pelvic girdle pain during their pregnancy. So I decided to focus on a couple of the most common complaints.